Welcome to today's episode of the CIO Water Cooler TV. My name is David Savage. I am joined today by Lee Rickles. Lee, thanks for being our guest. Before we get into anything else, do you want to explain who you are and what you do?
Yeah, thanks, David. And I really appreciate being asked to have this conversation today. So, Lee Rickles, I'm Chief Information Officer and Programme Director for a couple of things. So I've got responsibilities for the Yorkshire Humber Care Record. We provide a shared care record and pop health system based on open platform technology for the population of Yorkshire and the Humber, so around 5.4 million people. Chief Information Officer as well at Humber Teaching NHS Foundation Trust. We've recently had all the interesting experience around COVID, remote working. Was quite fortunate in some degree around COVID. It was already very digital before COVID hit. So as much as it was it's not a very nice experience we've been through. Nationally, the team and the staff were in a good place to work remotely, which paid up massively, especially our pharmacy team who really appreciated having electronic prescribing. And my final role is as the Chief Information Officer of Humber Coast and Vale ICS, which is that role is really working my peers and program leads who carry out the transformational system-wide change. Me, I'm really just one person, but I have some very, very capable people working for me. I'm very lucky in that respect. And also very lucky to do the job I do because I enjoy what I do and I get paid for it. So you can't really beat it.
Absolutely not.
Yes, David.
You said there about transformational change. Sorry to jump in and interject, but you said about transformational change and you mentioned a little bit about open platforms as well. Has the last year caused you to accelerate any of that kind of switch to those kind of platforms for your solutions, or was that already a roadmap that you were going down?
So we'd already had a roadmap for trying to move to open platform. Now, open platform doesn't mean open source, although open source is a good route to get to some of them technologies. It really is focused around open standards. So, you've got your 3-pin plug, you can stick it in the wall. You've got your electricity, it's 240. That type of way of working rather than, very bespoke vendor-specific ways of working. Whether that's clinical or corporate, we have as much challenge around our staff data, for instance, and some of them systems as well as our clinical systems. And all of them are really important, of course. So the open platform is one we've been pushing. On the Yorkshire Humber Care Record, it was what I would class as our unique selling point. We could start from a clean sheet of paper, basically. We can build around the open standards. We can build around not having a vendor lock-in, work with SMEs. SMEs really good to work with. If you really want to work with agile organizations that think quick and come up with really good solutions, or you find that you fail fast, there's nothing wrong with failing fast. It's better than failing and be very, very expensive. So the open platforms, very much something we was taking forward as a strategy, more from a systems approach, to be fair. And really that approach of build, most software is now software as a service, platform as a service. And we in health still seem to have this view of we've got to buy, we've got to have licenses, we've got to have an asset. When realistically that is quite an old way of thinking. So the whole approach we've taken is one, it means we can be far more agile. It means we can build around them standards. And also we do have a lot of flexibility of what we can do. We don't end up with that vendor lock-in. That separation of data and application layer that Matt Hancock and central government have been pushing for quite a long time. Well, that's the way we build these products now. So, it's a really good approach. Doesn't mean we don't work with vendors. It doesn't mean we don't work with SMEs. It just means we don't end up with that vendor lock-in and we really go around standards. So has COVID really changed anything? Not really. Did it benefit from it? Yes, absolutely.
So look, where we're talking about digital services and working with agile SMEs and a number of different vendors, that's great. But what if you've got a patient, and look, without wanting to put too fine a point on it, you're working in a part of the country where it's known to be reasonably deprived. If you're thinking about areas around the Humber. My grandma, bless her, she was from Grimsby. I know it's not exactly one of the most affluent towns in the country, and you have got some people there who probably don't have access to the latest digital technologies. So how do you make sure that they are not left out or locked out of services?
So that's a really good point, David. And I myself, I come from Hull, so not far from Grimsby, to be honest. So
Yep.
I have a really good understanding of that economic challenge. And it is a challenge, and it's a very difficult and different way of thinking. So there's probably 2 or 3 different aspects to this. So during a COVID situation, it's very difficult not to think digitally. So how do you put the tools in and provide the support without putting other people at risk of providing that support? And that is a difficult one. So I must be honest, on a lot of them services where we have had that digital poverty, that lack of digital inclusion, the good old telephone has generally been the answer. Most people have a landline. If they're, it's generally low cost, and for a lot of what you would class as a conversation or a checkup or something, it's helped. If we look at a lot of the commercial vendors, not many of them use video conferencing as a way of engaging with their customers. They still use a lot of telephony. Now, realistically, telephony is not the answer. And when we're looking at health, and we're looking at apps to support health and well-being, or you would need that video, or you would need some type of knowledge base, some type of smart device to help. In them cases, what we have done during COVID is provided free 4G devices with training and support wherever possible. The issue has been wherever possible. Obviously, early days of COVID, it was tough finding any laptops or devices just for the people that needed to do what they need to do. More laterally, it's really focused around the particular groups. So, or trying to work with what tech people already have. So, children and young people, providing smart devices with some type of connectivity works really well. Giving smart devices to some of the older population who aren't IT literate, but you cannot put that additional support in that VMS, that voluntary sector support that we generally on has been a bit of a challenge. So the real answer is we've tried to work around it. We've used other very low tech solutions. The reality is we still need to expand that digital capability. So that absolutely means we've got to move to more of getting that connectivity and then devices to patients to be effective. But it's not the perfect answer to everything. It could be, and I know we've got this working in some of our homes, just Alexas that can do some level of communication and work some simple apps. It doesn't always have to be a smart device with a video conference. I think that's the issue with health. There is so many options. There's so many different care pathways you could do. There isn't really a one size fits all. If we're trying to get personalized medicine requires personalized technology. For some people, that's voice. For some people, that's a video. For some people, it's Internet of Things devices.
I suppose as a CIO wearing a number of different hats, there must be the temptation to invest in a number of these different digital platforms and offerings that are available. And yet I think of my own experience, every single time I've spoken to the doctor in the last 12 months, it has been over the telephone. Is there a slight risk of getting a bit excited and over-engineering the process and that not actually helping a patient's experience?
So I think you got a really good point, David. And I've got the experience as well with contacting my own doctor by telephone, which I thought worked quite well, and the NHS app, which worked quite well. But this is where we need to be more customer centric. We need to consider the people we're providing care to and not just look at shiny things. It's so easy to say, here's a really exciting bit of tech. If we put this into everybody's house, it'd be so wonderful. But missing the main point of, would that really work for that person? Because although we're saying patients, everybody's a person, and it's people we're really supporting. And that person is more than just a patient. They've got a whole set of other dynamics, other things that run around that life. So the key bit, I think, at the moment is not to get too carried away with. We've done a lot during COVID on digitising the NHS. We've just got to make sure that we're finding the right tools for the public to work with us. So if a telephone works, what is wrong with a telephone working?
Yeah.
But if it really helped to do an AI algorithm and listening to the stress of somebody on the end of the phone to assess whether they're suicidal or not, that's not a bad thing. But we've just got to make sure the efficacy and the research and the supporting materials are effective enough to say that's a useful technology, and not just we spent a lot of money on something that doesn't really deliver. So again, Great tools for the right thing. Really good examples in Leeds where they're using imaging with DPI to really to look for cancer. Now that's a really good example where some high technology is used really, really well. They'll probably still ring the patients to tell them something, but that's where you got an AI come old tech. Yeah.
Yeah, no, it's the same lessons in other industries and just making sure that they're learned elsewhere as well. Look, Lee, it's been fascinating to chat to you. Obviously, a huge job on your hands, so I hope it continues to go well as we come slowly out of various different lockdown measures. But thanks for your time today.
Thank you, David. It's been great to talk.
And if you're interested in finding more of these conversations, there's plenty of episodes of the CIO Water Cooler TV. Have a look around the website.